Welcome everybody, welcome to another episode of PEM Rules. I'm your host, Yaron Ivan, as usual, and today some more important rules that hopefully will help you take better care of your patients. Rule number 182. Don't forget the distracting injuries even in a non-trauma center. So the credit for this rule goes to a PEM Rules listener who contacted me through the website and would prefer to stay anonymous, which I completely understand and respect. So Mr. Anonymous PEM Rules listener, thank you very much for this rule. And he contacted me via the website with an example and the reason he came up with it. So my listener a few months ago apparently was working in a community hospital, non-trauma center hospital. And in that hospital, patients who have traumatic injuries can walk in themselves, but they do not come with EMS. So this patient was brought in by mom. It was a toddler who fell off of the monkey bars. We all know this injury pattern very well. Patient had very swollen, very painful elbow, which looked like supracondylar fracture. And when the physician examined him, he was quite impressed. However, patient did well, had an x-ray consistent with supracondylar type 1, which is, very common. It's what I call the splint and send kind of injury. The patient was splint, had a follow-up with orthopedics, and everything seemed to fall into place very well. The person who contacted me, however, was very surprised and disappointed to see the same patient coming to the ER the next day. And apparently, the patient was complaining of wrist pain on the other hand. A quick x-ray revealed that the patient had a very small buccal fracture of the left side while the injury on the elbow was on the right side. And it was a very frustrating experience for the physician because he was so focused on what seemed to be a very obvious and painful injury on the right elbow, he totally forgot to examine or even ask about the left hand. Well, granted, the patient didn't have any serious injury on the left hand. However, a buccal fracture does hurt. Clearly, the patient was distracted by his more painful injury, but failure to check for distracting injuries is what led to this unfortunate event. So remember Rule 182. Even in a non-trauma center, assuming your injury is a distracting injury, and look for other injuries as well. Always. Rule number 183. Left lower quadrant pain in a child must do a GU exam. Now, many of us would advocate, and I am one of those physicians, that a good GU exam, or at least a GU history, is always necessary on any child with abdominal pain. I would say, however, that we all know testicular torsion is quite common in teenagers. There's another peak to my understanding in newborns, which I personally have never seen. However, it is quite a rare pathology in a toddler or a child. So I gotta be honest, I don't always do a GU exam if it's a 7-year-old with very benign story. Sometimes I do ask about testicular pain. However, I gotta be honest, I don't always perform that exam. However, when the child comes with left lower quadrant pain, I almost always make sure I do a GU exam. The reason being, to my understanding, from what I have always learned and practiced, there's really no surgical abdomen on the left lower side in kids. So those of us who work with adults know very well about diverticulitis, which can cause left lower quadrant pain. However, in pediatrics, the gallbladder, the liver, the appendix are all on the right side. So left lower quadrant pain always makes me a little worried about testicular torsion or ovarian torsion, which makes the testicular exam in a male very important. So remember rule number 183, left lower quadrant pain, do a GU exam in a male. Rule number 184, unusual or, for lack of a better term, funky neurological complaints, think about atypical migraine. So this rule really stems from my personal experience. In my career, which really is not that long, I've had several patients, mostly teenager females, who come to the pediatric emergency department with very unusual presentations and complaints. Some of them looked like they have a stroke. One side was weaker than the other, a facial droop of some sorts, or maybe even altered mental status. And after I rule out everything I possibly can, I think about atypical migraine I treat those patients for migraine, and very often I've got significant improvement or even resolutions. The patient just had atypical migraine. Speaking to some of my colleagues actually saw symptoms of paralysis of the lower extremities, again, as a presentation of a typical migraine. And I think obviously this is a diagnosis of exclusion, must rule out any serious pathologies first. However, when you have a patient with unusual, sort of acute onset neurological complaints after you ruled out a stroke or a space-occupying lesion or any CNS disease, I think it's very reasonable to think about atypical migraine, treat the patient for a typical migraine, especially if this has happened in the past, and that's a very key clue in the history, and look for improvement. To my surprise, I've had several patients in the past that when I treat them for atypical migraine, they just get better. So remember rule number 184, funky neurological complaints. Think about atypical migraines. Rule number 185, give yourself a break. So this rule, I think, is very important to practice literally for yourself and for your self-care. I think these days, pediatric emergency doctors or emergency doctors in general, or even just doctors in general, have a lot to deal with. Besides being concerned with our patients' clinical outcomes, we also have to be concerned with their satisfaction scores or patient experience scores. We often hear very much about it, and it sometimes gets a little too much. Many of the residents have their own families, wife, kids, etc. And sometimes it gets very difficult to be an excellent father, an excellent husband under certain circumstances. So when I was a fellow, I remember doing my trauma rotation in Pittsburgh, and the trauma rotation, for those of us who've done fellowship and know, is a very, very busy rotation. It's basically being there at 5 or 6 in the morning to rotate on your patients. Oftentimes, the shift doesn't end until very late, and it's a very time-consuming sort of experience. Under those circumstances, during that rotation, I didn't expect myself to be there for my kids all the time or for my wife all the time. It's practically impossible. You got to give yourself a break. As a pediatric resident in the PICU, you're probably not going to be the best father and husband, and you're probably not going to have a lot of time to work on your project, residency projects, whatever it is during that time. It's a very busy month. So give yourself a break when you are under those circumstances temporarily. Another good example for this rule is with simple patient outcomes. I think most of us emergency physicians do the right thing for our patients at least 85, 90, 95% of the time. Under any circumstances, that will be an A- or an A, and that's an excellent score. Sometimes you're going to miss abdominal pain, diagnose it as gastroenteritis, and the patient may have appendicitis. You should always do your best and review what you did wrong and use it as a learning opportunity, but you gotta give yourself a break. If you diagnosed 100 kids with appendicitis and missed 1 or 2, that is a very high percentage of success. So you gotta give yourself a break for those times you failed, given how well you do overall. So remember, you're not perfect, you're never gonna be perfect, but if you have such a high success rate on diagnosing and doing the right thing for your patients, that may be all you can do, and that's okay. So remember, rule number 185, give yourself a break with patient outcomes, with the time you dedicate to your family and friends during a busy rotation, etc. And that is it for today, guys. Thank you very much for listening to PEM Rules. Let's briefly review what we learned. Rule number 182. Do not forget the distracting injuries. Even if you don't work in a trauma center and the patient comes in with what seems like a very single specific injury, a complete physical exam goes a very long way. Always think about the possibility of other injuries being there, and that injury you're seeing in front of you is just distracting. Rule number 183, left lower quadrant pain in the male, must do a GU exam. Again, I would advocate for a good GU exam almost always, with several exceptions. However, if the patient has left lower quadrant pain, which really does not explain a surgical abdomen in a child, must do a testicular exam and think about ovarian torsion in a female. Rule number 184, funky or unusual neurological complaints, think about a typical migraine. After you ruled out any serious, dangerous, or surgical pathologies, try a migraine cocktail and see what you get. Rule number 185, give yourself a break. You got to give yourself a break with regards to patient satisfaction scores. You're not always going to make everybody happy. You got to give yourself a break with patient outcomes. You're not always going to diagnose and do the right thing, even if you try. You diagnose appendicitis 100 times, you missed 1 or 2. That's a very high percentage rate. You got to be realistic and realize you're not going to be perfect. Do your best, strive for the best, try to work on your mistakes and what you did wrong, but give yourself a break. And that is it for today, guys. Thank you very much for listening to PEM Rules. Please continue to check the website and write to me if you have any rules or if you want to come on the show to have a discussion about a patient you had. Really, whatever you want to have is good with me. You can go to pemrules.com and contact me this way anytime. The following outro is a great bass line by Peter Gabriel from a song called Sledgehammer. Very specific bass sound that I try to recreate here. Not sure I did a great job. Hopefully you like it. Thank you very much. Thank you.